Okay, everyone. My name is James, and I'm a member of the Spring Socialist Network. I write for Spring Magazine, and I'm broadcasting from Toronto. I can see everybody joining the meeting. We're at about 121 participants so far, with more people joining. And I can see lots of people joining in the chat, letting us know where you're watching from. So I'm going to begin with a land acknowledgement. We would like to acknowledge that the land where we are broadcasting is and has been for thousands of years the traditional land of the Haudenosaunee, Anishinaabeg, the Huron-Wendat, the Seneca, and most recently the Mississaugas of the Credit River. This territory is the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. The word Toronto itself originates from the Kanien'kehá:ka word Takaranto, which translates to the place in the water where the trees are standing. The reference is said to come from Haudenosaunee and Huron-Wendat fishers hosting stakes for fishing weirs in the narrows of the river systems, many of which are now mostly paved over with concrete. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. We seek to build awareness and active solidarity with Indigenous peoples. So welcome everyone to today's webinar hosted by Spring Socialist Network and Spring Magazine. The title of today's webinar is COVID-19 Crisis, a Socialist Response. And what I'm going to do, I'm going to just quickly go through the agenda. I'm going to explain how the webinar works. That's the first thing. Then I will introduce the speakers. The speakers will each speak for 20 or 30 minutes. We have 3 speakers. There will be questions and answers, so you can post your questions in the question and answer section that should be at the bottom of your screen. There's also a chat section on the right-hand side of the screen where you can chat with each other, let us know where you're watching from, make any other comments. There'll be time for concluding remarks at the end, and we'll end probably after 2 hours or so. We have up to 2.5 hours for this webinar, and we'll aim to be done in 2 hours or so. We are recording the webinar, so we hope that we can post it later for as a resource for us to share. And there will be other occasions that we broadcast online like this through webinars and meetings, and we hope you'll be able to participate in those. So I think that's everything for how the webinar works. That covers the agenda. We have 3 speakers who are going to join us today. They are Jesse McLaren, pronouns he, him, is an emergency physician and member of the Decent Work and Health Network. He will be speaking on the webinar as a member of Spring. Followed by Jesse will be Pam Frache, pronouns she, her. Pam helps coordinate the fight for 15 in Fairness campaign in Ontario and is an organizer with the Workers' Action Centre in Toronto. She will be speaking on the webinar today as a member of Spring. And the third speaker will be Rechev Browne, pronouns he, him. Rechev is Vice President Alternate for the Workers of Color Committee, Ontario Federation of Labour, an organizer for the Fight for 15 in Fairness campaign in Etobicoke Lakeshore, and a proud member of UFCW Local 1006A. And Rechev recently has an article on Spring Magazine, which talks about his experience as a grocery store worker. And I encourage you to check that out at springmag.ca. So we're going to move now to the speakers. The first speaker will be Jesse McLaren. Jesse, I'm going to turn on your video for you. You'll just need to unmute Jesse, and then you'll be ready to go.
Okay, can people see the slides? No. In the dark here. Can people see the slides? Not hearing from anybody.
Yes, we
Yeah,
can.
sorry.
Yes, we can all see the slides.
Thank you. Sorry. So thank you everyone for joining the webinar. I'm going to be talking about some of the medical and intertwined political aspects to the crisis. And I think I just want to acknowledge that in the midst of a pandemic causing a global health crisis, this is obviously very stressful times, and it's important to identify that stress, both so we can help take care of each other, but also because I think that in any crisis, it can be easy to give way to panic or to measures that actually worsen the crisis. So I just want to start this session by posing 4 basic questions. Not that I can suggest that I can answer them, but just just to begin to address some of the issues and to suggest a framework for addressing them. So these questions are, sorry, slide advance. What is the pandemic? Why is it creating a health crisis? What won't work? And what do we need? So first, what is the pandemic? In other words, what is this curve that we need to flatten? And I would suggest that it's actually 3 interrelated curves. And I'll be drawing on a framework developed by the director of the World Health Organization Program on AIDS in the 1980s. And this is how they explained it. It's useful to consider AIDS as 3 distinct yet intertwined global epidemics. The first is the epidemic of the HIV infection itself. The second is the epidemic of the disease. And finally, the third epidemic of social, cultural, economic, and political reaction, which is also worldwide and is as central to the global challenge as the disease itself. AIDS has unveiled the dimly disguised prejudices about race, religion, social class, sex, and nationality. Now, obviously, COVID-19 and AIDS have many differences, but I think that this framework is essentially the same. The first pandemic is the virus itself, which is now called SARS-CoV-2. Thankfully, it's not airborne, but it can be very easily transmitted by droplets like coughing and sneezing, and it stays on surfaces for days. Its incubation is up to 2 weeks, and it can be transmitted before any symptoms. And so this basic information informs the public health recommendation to all individuals, which is cough or sneeze into your sleeve, wash your hands, clean your surfaces, practice healthy distancing, and self-isolate for 2 weeks if you're exposed. Disease itself, which is now called COVID-19. This causes fever, cough, difficulty breathing, and potentially pneumonia. Overall, 80% of cases are mild, requiring self-isolation. 20% are severe, requiring hospitalization. And of these, 5 to 10% are life-threatening, requiring intensive care. And these risks are not evenly distributed. Anyone can transmit the virus and get the disease, as can be seen from the blue bars, but the mortality rate rises with age, which is the orange bars, as well as chronic health problems. The overall mortality rate is 1 to 2%, which is 10 times that of the flu, but it can be 10 times greater than that for elderly or immunocompromised patients. And this also reinforces the importance of everyone following basic public health advice, both because anyone can get and transmit the virus and also protect the most vulnerable from the disease. Then there's the third pandemic, which is the social, economic, and political backlash, especially anti-Asian and anti-migrant racism and generalized xenophobia, which is, as with AIDS, as central to the disease itself. The second question is, why is there a health crisis? In other words, why does COVID-19 overwhelm healthcare system capacity? And this is also related to a number of reasons, and I'll list 3. The first reason is obviously the number of cases and the disease severity. If the virus only caused the sniffles, it could infect 1 billion people, but it wouldn't cause a healthcare crisis. But because 20% of patients require hospitalization and 10% require intensive care, then it's obvious how it can overwhelm healthcare systems. But whether or not a pandemic overwhelms healthcare system capacity obviously also depends on what that capacity was like before the pandemic, and whether or not that capacity increases during a pandemic. And I think one of the problems of this diagram is that it assumes that healthcare capacity is fixed at a level that is not able to deal with surges and which remains fixed, a totally straight line, even during a pandemic, which I think is more reflective of political priorities than biology. If we look at hospital beds per capita in the 3 decades before the pandemic, we see that Italy, the UK, the US, and Canada have been cutting hospital beds for 30 years, making us less and less prepared for a pandemic. And Canada is the lowest of them all. On the other hand, South Korea has been massively expanding hospitals for decades, and China responded to the pandemic by building 10 new hospitals in a short period of time. And this directly influences the disease severity. The mortality rate in Italy is 5%, while that in South Korea is 0.5%. Now, we're reminded that COVID-19 is serious because its mortality is 10 times that of the flu. But COVID in Italy has 10 times the mortality rate of COVID in South Korea, and it's the same disease. Part of this reason is because Italy has an older population that are more at risk, but part is also because South Korea has a much greater hospital capacity. The lesson is that if Canada does not expand hospital capacity and expand who has access to this capacity, we could have a mortality rate like that of Italy rather than South Korea, not because of the disease, but because of cuts to healthcare. And a third reason why COVID is creating a health crisis is because of inequality. And this is directly related to the COVID crisis for a number of reasons. First of all, poverty and precarious work increases the rate of diabetes, hypertension, and coronary artery disease, which are all chronic health conditions that increase COVID mortality and therefore increase the need for hospitalization and intensive care. Secondly, the wave of layoffs in response to COVID threatened to increase inequality, which itself would worsen public health. And thirdly, inequality denies protective measures, essential that those with mild COVID stay home when they're sick. But to do this, you need a home, which is denied to homeless, evicted, and incarcerated people. You also need the job security and paid leave to be able to stay at home and off work. But those with the lowest wages, who are in the greatest need of paid leave, have the least access to it. This is not only an economic issue, but an issue of equity, because women, migrants, and racialized people are disproportionately concentrated in precarious jobs and denied paid sick leave. Third is the question of what won't work. And a guiding principle of medicine is first, do no harm. If we're facing a first pandemic of virus, a second of disease, and a third of backlash, intertwined with healthcare cuts and economic inequality, then we need to oppose policies that not only fail to offer protection, but that will worsen them. The first of these is racism and xenophobia. And this image is from a campaign from the Chinese Canadian National Council, and it says, "Stop the spread of racism. Ignorance has reached epidemic proportions." And we've already seen how this has undermined the ability to respond. When the virus first emerged, the media called it Wuhan coronavirus, or Chinese virus, which led to a racist backlash against the Chinese community, and also undermined how we understand disease and how to prevent it. As U of T student Frank Ye explained to the media, when we peddle racist ideas, when we peddle xenophobia, that isn't going to protect you from the virus. Proper public health procedures and precautions will protect you from the virus. Racism won't. The second response, connected to the first, is travel bans and closing borders. Now, obviously, people should be making every effort to limit their non-essential travel. But for many people, travel and migration is absolutely essential, and closing borders is not an appropriate public health response. First of all, it doesn't work to stop the first pandemic of viral spread because of its incubation period and easy transmission. Travel bans didn't work in China, where this graphic from Science magazine found that the local travel ban on Wuhan only delayed the epidemic in China by 3 to 5 days, and international travel bans only delayed global spread by 2 to 3 weeks. Travel bans didn't work in Italy, which was the only European country to ban all flights from China and is now the epicenter of the disease. Secondly, closing borders does nothing to help expand healthcare capacity so we can deal with the second pandemic of COVID pneumonia. And Trump makes this clear. He banned travel from China and then Europe, and yet can't be bothered to get enough testing for people in the US, millions of whom are denied healthcare. And thirdly, closing the borders fans the flames of the third pandemic of xenophobia, making it seem like COVID-19 is a foreign invader and equating it with migrant and racialized people. And Trudeau made this clear with his travel ban, which is actually a citizenship ban because it exempts Canadians and Americans from border closure. Now, the problem is not the exemptions, the problem is the border control, which does nothing to keep us safe and only medicalizes anti-migrant racism. And it's been a partial victory that migrants' rights movements have won a partial opening of this border for international students, farm workers, and care workers. The third strategy that won't work is forcible quarantine. Now, quarantine technically is just the act of isolating people who have been exposed to an infection but not yet developed symptoms. And because the virus has an incubation period of 2 weeks, it's essential for those who have been exposed to isolate themselves for this period. But to do this on a mass scale, we need to empower everyone to isolate themselves, not threaten a minority with forcible quarantine. But throughout history, quarantines have become repressive measures used by states to persecute marginalized communities, from the quarantine of Chinatown in San Francisco in the early 1900s to the quarantine of African migrants in Italy in 2020. And we can see the politics of quarantine from the conservative health critic. So step one is it starts with border control and leads immediately to step two, which is mandatory quarantine of travelers, a term that is distinguished from Canadians. This implies that coronavirus is a foreign threat that must be forcibly contained, which fans the flames of the third pandemic of racism and xenophobia. Step three then is to encourage Canadians to practice social distancing without empowering workers in any way to actually practice this. The refusal to provide paid emergency leave will worsen the first pandemic of viral spread. Then it goes back to xenophobia by banning flights from so-called high-risk areas, and ends with vague calls for information and protocols, without addressing hospital capacity to deal with the second pandemic of COVID pneumonia. So according to the Conservatives, our health depends on border control, travel bans, and forcible quarantine, expanding the power of the police rather than the capacity of hospitals or the financial ability of workers to self-isolate. Finally, what do we need? We obviously need to massively expand protective measures to flatten all of the curves. But xenophobia, border control, and forcible quarantine won't work. Fortunately, there are many policies that will, and that we desperately need, and I'll just list three of many. First is expanding healthcare and access to healthcare. South Korea shows that universal healthcare, large hospital capacity, mass testing, and pay for those in isolation can help reduce mortality rates and flatten the curve. Now, here in Ontario, we have multiple barriers to healthcare, but we're already starting to address them. So public pressure has pushed forward to open up hospital beds, to open up free testing centers, to eliminate the waiting period for OHIP, and to cover healthcare costs for uninsured people. And we need to expand all of these and make them permanent. Secondly, we need to expand paid emergency leave for all. We know from influenza that lack of paid sick days leads to greater infections, but winning paid sick days helps reduce infections. A number of provinces from Alberta to Ontario have won job-protected leave, but this has to be paid if we want to reduce COVID crisis and the associated inequality. As a recent report from the Canadian Centre for Policy Alternatives explained, in the 5 lower to middle income professions where women are most likely to be employed, caring, clerical, catering, cashiering, and cleaning, only one type of job, clerical work, could potentially be done from home. The other 4 are by definition in-person jobs, and workers in 3 of these professions, caring in healthcare, childcare, and long-term care, catering in food preparation, and cleaning will be on the front lines of combating the virus. The stress on the primary and long-term care systems will be borne largely by the women who staff these front lines. Ensuring that sick workers stay home will be critical to slowing the spread of COVID-19. And thirdly, we need to expand financial support for all. Otherwise, the layoffs associated with COVID will drive more people into poverty, worsening the crisis of inequality, which itself would be a health disaster. So for these reasons, the Decent Work and Health Network has been advocating for paid emergency leave so that workers can recover at home and protect the public, for access to EI to reduce income inequality, which is a key social determinant of health, and for opposition to racism and xenophobia. And if there's any healthcare workers of any kind on this call, please go to Decent Work and Health Network and join. And for everyone, regardless, please sign and share the petition from the Migrants' Rights Network, calling for healthcare and status for all, worker protections and community support, and following the lead of those most affected by the health and economic crises. These demands not only help flatten the curve, but will also help flatten the inequalities that have plagued us for so long. Thank you.
Okay, thanks, Jesse, for that great introduction. And there are lots of excellent comments in the chat. A couple of questions before we move on to the next speaker. So there's been a request, or many requests, for us to share the slides after the webinar. So we'll make those available after the webinar. So everyone who participated, anyone who would like to share them, will have access to them. I think we'll post them on the event page on Facebook or on Spring Magazine. There'll be a number of places we post it so everyone can get access to it. So that's the first thing in response to that question. We are also recording the webinar, so we will make that available as well and let all the participants know how they can access it and share it. We'll need to figure out how we share it afterwards, but we will get to that hopefully today or tomorrow. The other thing I'll just draw your attention to is that at the bottom of your screen, there should be a button for Q&A. So if anybody has any questions at all during the webinar, during any of the speakers, just post them on the Q&A, which comes to the panelists, and I'll be reading them or summarizing them so everybody knows what the questions are when we get to the Q&A period. So you can discuss and comment among yourselves in the chat, which I think is public. Everyone can see that. And then for the Q&A, if you just post your questions there, I'll make sure that I summarize those so everyone can hear that. Okay, so thank you again, Jesse. Our next speaker is Pam Frache. And Pam, I'm going to ask you to turn on your video and to unmute. Great, so can everyone hear Pam? Do you want to do a test, Pam?
Hi.
Great, okay, Pam, please go ahead.
Great. Thank you very much. And Jesse, thanks for that excellent introduction. I apologize, I don't have the same PowerPoint prowess as Jesse, so it'll just be me talking. But I want to divide my talk into three portions. One, I want to talk about the nature of the measures that have been announced so far, because I think there's a lot of confusion around that. Then I want to come to the question about who pays for this crisis. And I want to end with what kinds of considerations inform socialist strategies for addressing this particular pandemic, and to think about how we want to be able to emerge from this on the other side. So the first thing I'll just start with is just the unbelievable disaster that this is for ordinary working families. In Ontario, we had a premier who basically told everyone to head out wherever they're going to have the best March break ever. And 24 hours later, they announced they're closing every school in the province. So what he basically did in an instant is not only worsen the health crisis by ill-informing people about what the practices are that are necessary to be able to address the crisis, but then he created a further economic crisis by depriving thousands of workers of their paid income while the schools were closed, and depriving parents of childcare, without putting any supports whatsoever in place to support workers. They managed to take a health crisis and transform it into an economic crisis literally overnight. And the impacts of this have been cascading. That's why the Fight for 15 and Fairness has been calling for 21 paid emergency leave days, 7 of which would be permanent on an ongoing permanent basis, and 14 additional days whenever there's an outbreak like COVID-19 or a pandemic. And what this would have allowed to have happened is that it would have secured workers' incomes while they're self-isolating or while they're looking after children. And it would have actually bought 3 weeks of additional time for the federal and provincial governments to roll out a program that is coherent and that puts in place the protections that are needed. So I'll just talk about the measures that have been taken to date, because I think many people hear that there have been dramatic improvements to employment insurance, and they think that they're going to have access to the support for them. And I want to just take a few minutes to unpack these things. So the first announcement that the federal government made was that they're waiving the 1 week waiting period to access EI benefits. Well, when you read the fine print, it's not actually waiving the 1 week waiting period to access benefits. It's only waiving the 1 week waiting period for EI sickness benefits, and only for those people who have been directed to self-quarantine. So in other words, it's a very narrow section of people who are going to be able to access the waiver of the 1 week waiting period. And as we all know from our own experience, never mind the experience of others, losing even 1 day's pay, never mind a week's pay, is going to be an absolute disaster. So that's the first problem. But the second problem is that EI, if you're lucky enough to get it, provides only 55% of your income. So imagine all of the people in Ontario who are trying to survive on $14 an hour. 55% of $14 an hour is simply unsustainable. It's a disaster. But think about a province like Saskatchewan, where the minimum wage is $11.32 an hour. And then imagine surviving on 55% of that. And again, only for those people lucky enough to be able to access EI regular or sickness benefits. And I want to pause on that, because as Jesse alluded to, years of cuts, chronic underfunding of employment insurance has meant that at any given moment, among the unemployed population, about 60% of workers are not getting EI, employment insurance, when they need it. That is a staggering figure. And we need to know why that's happening. The reason why so many people can't access it is because of very tight restrictions that were imposed, ironically, by a federal Liberal government in the mid-1990s. And before I unpack this, I should also pause to say that for workers in the gig economy, for workers who are misclassified, for part-time workers, and for workers in precarious employment, the rate of access to employment insurance when they need it is only 20%. In other words, 80% of workers in the gig economy or in part-time and precarious employment actually get access to EI when they need it. And here's why. First of all, there's a huge amount of misclassification, particularly in the gig economy. And so it means that neither the employer nor the workers are paying EI premiums. And so they're basically shut out of the program entirely. And we all know that misclassification is an epidemic, where people like security guards and cleaners and others are considered to be self-employed contractors and therefore denied not only their employment insurance, but their pension plan, Canada pension plan or Quebec pension plan. They're denied their workers' compensation. They're denied any of their rights that are established under the employment standards in each province and federally. So that is itself an unmitigated disaster. But in addition, workers, not only do you have to be able to be included in the insurance program, you need to have very high levels of employment to be able to access it. So 420 hours to 720 hours are required to be eligible, to qualify, I should say, for EI. And as we know, part-time workers have a very difficult time, or shift workers, casual workers, and so forth have a very difficult time getting enough hours to be able to qualify for EI. We also have a situation where the duration of income support from EI is so small, is so limited, is so narrow, that many people exhaust their EI either before they get another job or because they've used up their EI and now that a pandemic has hit, they haven't been able to requalify. So we have that problem. And then we have the very arbitrary rules that make it impossible for many migrant workers to be able to access, with arbitrary rules saying that if you're not in Canada at the particular given moment, that you're accessing parental leave or sickness benefits, then you're not eligible for EI. And these are just nothing but trying to boot people out of the system for no reason at all. Because again, we have to remember that workers who are classified as workers are paying into the EI system along with the employers. But for people who are deemed to have quit their jobs, they're not eligible for employment insurance. Or if they're fired from their job, they're not eligible for employment insurance. And how many people, we know there's no job protection for people to be fired for very arbitrary reasons. And so many workers don't have the right termination slip basically from their employers. And so they're denied access to EI. So EI is a very poor substitute for the paid emergency leave that workers need. And while we're calling for 21 paid emergency leave days for all workers, we're also calling for a dramatic increase in access to employment insurance. And we're calling for an emergency fund for workers who do not qualify for EI or who are not eligible for EI, to make sure that that is there for them when they need it, and that those benefits are livable. In other words, they should be not one penny less than $573 for all workers, either through whether they're getting income support through employment insurance or whether they're getting income support through the emergency funds that have been created. And I'll just let you know that figure is essentially reflects the EI maximum benefit for 2020. That's where the figure came. And we are calling for a floor, a benefit that's no less than the current EI weekly benefit. But honestly, it on a go-forward basis, we need to improve the amount of income support that people get, because 55% of income for most people who are in low wage and even modest wage jobs are not well protected because of this. And then I want to just touch briefly on the situation in the provinces, because many people were confused to hear that Doug Ford is going to protect every worker's jobs. No one is going to lose their job. And you would think that that would be about creating the financial means for workers to be able to follow the advice of health providers. But instead, all that the Ford government has done is said that anyone who had to take time off as a result of COVID-19 will not lose their job. And that's supposed to give protections for people who had to stay home and look after their kids. But once again, without putting into place the supports for workers, these provisions are absolutely meaningless. And when workers don't have supports, either to look after their kids, if they don't have the supports to be able to stay home to look after their kids, it means that they're actually, in many cases, being forced to come up with ad hoc solutions. Can the grandparents look after the grandkids and so forth, which, as we learned from the experience in Italy, was an unintended consequence of government closing the schools without putting in supports for parents to be able to stay home and look after their kids, was to actually increase the contagion toward the elderly. So these are the kinds of things. What we see right now that's happening is that we see workers being forced into work without the paid sick leave and paid emergency leave that would protect them. But at the same time, we're also seeing workers forced out of work without the income support to help them survive. And so we're seeing a polarization on both extremes. And Rechev, I'm sure, will talk about this a little bit later around the question of grocery store workers. And while we can certainly celebrate the $2 an hour wage increase that Galen Weston is going to be giving these workers temporarily for their work during this pandemic, what is not going along with that $2 an hour increase is paid emergency leave days, which in fact increases and intensifies the pressure on workers in low wage and precarious work, because they're not going to want to forego decent pay for that limited window that premium pay is available. So you can only begin to imagine the pressure that's going to be on people to work as many hours as possible, to deny their own health considerations, and to be coping with all sorts of other situations in their workforce. So again, we need strategies that put workers at the heart of it. And I'll just say that even though this is, we're socialists who are speaking right now, even the Economist magazine has basically come out and said, given the scale of this crisis is posing to global capitalism, that the first priority of governments must be to stabilize households. And the first order of business is paid sick days, for all the obvious reasons that we have just gone through. And yet, across Canada, and shamefully not in any progressive government, has put in the necessary paid emergency leave days provincially, and shamefully the federal government has not put in place the 21 paid emergency leave days either. So it's a complete, I actually find it shocking, even though just when you think you can't be further surprised by the ugliness of capitalism and the failure of our elected leaders, then you just are all over again. Now I'm going to move on to the question of who pays, and I did notice that there's a couple of actually there's way more questions now in the question box, but I'll mention that it's important for us to understand how the employment insurance system works, so that we understand why it is an important program to expand. I'm sure many people will be surprised to learn that the federal government contributes not 1 cent to employment insurance. Not 1 cent of employment insurance is funded by the federal government or by our general tax dollars. EI is funded solely through premiums paid by employers and by workers. And in fact, employers pay more than workers, because it is always understood that employers have more control over whether workers are hired or fired or let go and so forth than workers themselves have. And in fact, that ratio is that of the EI premiums that are paid, employers pay 7/12 of those premiums, and workers pay 5/12 of those premiums. So it is the one program, because it's done as a payroll tax, that employers can't get around through the various tax cuts. It's also why there's a huge incentive to misclassify workers and to pretend that they're independent contractors. But I also want to talk about the premium rate, because if you listen to the dialogue created by employers, you might think that EI premiums have been skyrocketing for 30 years, and that employers need a break from all these premium increases and payroll taxes and job stiflers and such. I think most people in Canada would be shocked to learn that the current, and this is just mind-boggling to me, the current premium rate of $1.58 per $100 of insurable earnings is almost half of what the premium rate used to be in 1994, when the premium rate was $3.07 for every $100 of insurable earnings. So we have a situation where successive governments have actually reduced the money coming in to fund our employment insurance programs. And some of you may remember the massive surpluses that existed in the mid-90s and then again in the early 2000s. Those massive surpluses were created because the Liberals and other government and subsequently the Conservatives implemented such restrictions on workers' ability to access EI that so many people can't get it anymore. These massive surpluses developed. And what were they used for? They were actually used to offset corporate taxes. So when federal governments cut corporate taxes, they took the EI money and basically used that to balance the budgets. And so just to give you a sense of this, between 1996 and 2008, the EI fund had a surplus of $56.9 billion. Now, keep that in mind, because the amount of money that the federal government has said they're going to put toward helping workers is only $27 billion. So it's a drop in the bucket compared to what we would have had we had an EI fund that was properly funded. But I want to say something else. The emergency funds that are being set up and funded out of general revenue. Employers would like nothing more than to drive as many people into the general revenue funded emergency programs. The more people they can deny from EI, the more people will be driven into the emergency programs funded by general revenues, which means that we're moving money away from education and healthcare in order to fund supports that should be paid by employers. And frankly, my own feeling is that employers should pay the entire cost of employment insurance. But that is something that we really need to understand. The more people that get booted out of EI is basically an argument for employers to pay less and have less responsibility for looking after workers. And we want the opposite of that. And that leads me to the question of universal basic income. And I just want to take a few more minutes, if I could, to just unpack the question of universal basic income, because I get it. So people find the level of social assistance rates in Ontario. Ontario Works and Ontario Disability Support Program are so inadequate and condemn people to such a miserable and a horrible existence that I think it's very difficult for people to imagine another system that could be made that could make them, or could even worse circumstances. It seems very difficult to believe. But let's just unpack the question of universal basic income. And first of all, I want to say out right off the bat, the first thing we don't want to do is to create a subsidy for employers to rely on cheap labor strategies. So we know, for example, that the biggest users of minimum wage work, or workers in minimum wage jobs, are big corporations with over 500 people. And we just have to kind of look around the room to see who we're talking about. We're talking about the minimum wage earners at Cineplex Odeon Theaters. We're talking about the minimum wage earners at McDonald's and Tim Hortons and all of these incredibly profitable outfits that are getting these big profits precisely because they're not paying their workers a decent wage, and because they're denying them paid sick leave and paid emergency leave, etc. So the first thing we want to say about universal basic income is that we don't want to inadvertently create an incentive and a subsidy for these corporations and actually undercut those employers who are actually paying a decent wage. Because if one company can pay a crummy wage and another company is paying a decent wage, why should the decent wage employer have to compete with the cheap labor strategy of the other? So that's sort of a capitalist logic here. But there's some other real questions, and especially about the nature of universal basic income under a capitalist state. So first of all, it's not practical, because the amount of money people need to actually have a dignified life is way more than $1,000 a month, which I see as some of the proposals floating. So even if we were to say, what is a livable wage? Is it, let's say every man and a woman of, whatever age cutoff is to be entitled to, say, $40,000 a year, a quick, multiplication of the number of people that it would impact and the cost of that would very quickly exceed our total revenues that as they're currently collected under capitalism. And so it's also then very easy to see that as soon as you start funding people directly through state provided revenue, they're going to start cutting our social wages. And by social wages, I mean our healthcare, our public education system, the things that for which we pool our tax dollars in order to provide these collective services. That's what's going to wind up happening. They'll wind up cutting those kinds of social wages in order to provide people this kind of direct wage. And we got a glimpse of this in Ontario with the basic income pilot project that was not A, not adequate, but B, all of a sudden those people who are receiving it suddenly were not allowed to access the same kinds of supports that they used to have access to. And for people with disabilities, having to take care of getting a wheelchair fixed, you know, from a private service provider at a profit was not something that made their lives better. It actually made their lives worse. So that's you know, another practical example about life under capitalism and life under the system that we live in. But I think we have to also have a theoretical understanding, and that this capitalist state is not neutral. It exists to hold up the well-being of capitalism, and as a consequence, the role that this capitalist state plays is not to save us during crisis, but to save capitalism during crisis. So the state will never provide essentially an unlimited strike fund for ordinary working people. They simply won't do that, because the role of the state is to actually drive people into the labor market and prevent people from having any alternatives than to work for this or that terrible boss. So I'll just wrap up my remarks with a couple of considerations. How do we need to think about the solutions going forward? And there are going to be a huge number of demands as this health and economic crisis unfolds. But I want to say that our response must be informed by a vision of uniting the international working class. And we have to understand that the international working class is by definition a majority of people of color, a majority of women, and all of the diversity that exists within that. If we cannot unite as a class, and I will also say paid and unpaid, workers are not just those paid in the workplace, but all of us who work for a living directly and indirectly, we need to be united. And we cannot unite if we're divided by racism and xenophobia and Islamophobia, transphobia, and all the things that weaken our movement. So it does mean that every strategy must be informed by whether or not this particular solution increases solidarity or does it decrease solidarity? Does it increase the fragmentation of the international working class, or does it undermine, or does it build solidarity? So all the things that Jesse ended with by saying border controls, chasing symptoms and chasing individuals as if this is a solution, closing borders. The fact that we have international sanctions being imposed on countries like Iran or the siege in Gaza, we have to call also for an ending of economic sanctions, because anything that makes it possible for workers to have more choice and more agency and more mobility, workers, we need to trust that we will all do the very best things possible to mitigate a contagion and also to support each other economically. But we can't do that under the threat of a capitalist state that is threatening to incarcerate us, that is threatening to separate us, that is separating loved ones from family, the children that are in detention centers right now. Our strategies must be informed by a vision of international solidarity. And whether it's a local strategy or an international strategy, we have to be asking the question, no worker left behind. We say, open the borders, let the families reunite, healthcare for all, housing for all. Let us make maximum choice possible for ordinary people, and let's try to build our strength so that we can use maximum force on the corporate vultures that are killing the planet, that are killing humanity, and whose solutions to this crisis are never going to meet the challenge. We have solutions, we can fight for them, and we can make it happen. And I'll stop there.
Okay, thanks, Pam, for that introduction. And thanks again to all the participants who are sharing comments and questions in the chat. We're also getting lots of questions that we're going to turn to in a moment on the Q&A, so please continue to do that, to send your questions there. I'll also let you know that we are well over 200 participants on the call right now. We have a number of people who are joining us in groups, so there might be 3 or 4 or 5 or more people who are watching from one link. So we're definitely over 200. So we're really happy that so many of you have been able to join us, and we have participants from all across the country. And I think there has been a suggestion just to let others know where you're watching from. If in the comments or the chat you can indicate where you're watching from, or you can even include that in your name if you rename yourself. So thank you for doing that. We're now going to turn to our next speaker, Rechev, who has just been able to join us. Rechev, I'm going to unmute you and ask you to start your camera, which you can start at any moment. Or if you prefer to broadcast without the camera, that's fine as well. So Rechev, you are now unmuted. Rechev, go ahead.
Hi. Thank you guys. Thanks everyone for participating in this amazing webinar. I'm actually at work right now, which is ironic. Yeah, so it's been crazy here on the front lines, if I can call it that, at our stores. We've definitely been asked to work more hours. Like I normally work 40 hours, but right now I've been asked if I can be on call on my 2 days off. I'm not sure if that's a good thing or a bad thing. I'm still reassessing that with myself. In terms of like our safety, we've been told to constantly, every chance we get, to take our gloves off. So we've been provided gloves and to sanitize and wash our hands as much as possible. But I don't think that goes far enough, because there's times when we're actually stocking shelves and like there's too much customers in like one aisle. And we've asked what are we supposed to do in those situations, and they're technically telling us to just leave whatever truck, whatever we were doing, and then go back to it after. Which means now that we stay at work longer than we're supposed to, because we're technically working. What a truck that would normally take 10-15 minutes, now it's probably gonna take like 20-25 minutes to do, right? They've been limiting the amount of people coming in the store, which is kind of good. But still, like, some people are not respecting the social distancing rules. Also, we've started, I think yesterday, we've limited the amount of cashiers that can be on cash. So there's at least 2 meters between them, and it's causing like serious lineups. Like at my store, for example, we have 8 registers. So register 1, 3, 6, and 8 are open. And like people are just like being like losing their shit, if I could say that, on us. In my case, people are asking me, "Oh, why can't you guys open more registers? Like it's a long line." And I'm trying to explain to them that in order for us to stay open, in terms for the grocery store to stay open, we gotta take the necessary precautions, not only to protect ourselves but to protect our workers here, right? I'm sure you've all heard about the announcement made by Loblaws yesterday. So we've been given a premium increase, which is going to go back from March 8th to April 30th. So some of us here will be receiving our back pay. And I think what they're going to do on April 30th is that they're going to be revisiting if the issue is still as serious. Now, I mean, for me, it raises concern, because like we've proven already that, okay, yeah, we're grocery store workers, but like we've proven ourselves to be an essential services. So we've been kind of like, me and a couple other people here at work, been kind of wrap our heads around how are we gonna force not only Loblaws but also our union to force Loblaws to keep that $2 after, or let's say, for example, this coronavirus magically disappears, right? So those are just some things that we've been looking at going forward. I think for us, in terms of organizing, we're in a really, 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 really good position right now. In terms of even our next collective agreement, like, because we've seen how important our services are. So yeah, like, what do we do, after April 30th? Like, organize. Like, we're in a good state right now. A lot of my co-workers are concerned, like, mostly about like their safety. Some people are concerned about like having paid time off. Like, a personal story of mine is that my cousin who works here with me, his wife is a nurse, so she's working a lot of hours too. And now they have a child who's home from school, because school's closed for 2 more weeks. So he's already used up his 3 consecutive parental leave, and he is not able to find a babysitter. So now they're asking my cousin to go on EI, which he doesn't want to do. So he's thinking now about like using up his vacation days, right? Which is not fair, for him. It's not fair for his family. I think the government should be providing us with paid emergency leave and paid time off. And that's what we've been dealing with here on the front line. So again, I wish I could stay on the call, but I literally got to run back to work. I just took my 15-minute break to come and share my story with you guys. Hello?
Thank you so much, Rechev. That was amazing, and we are really grateful that you were able to join us during your break. So thank you for that. And if you have to run and leave the call now, that's totally fine. What we'll do is, as I said, we're recording this, and so we'll post this online shortly afterwards, so everyone can have access to it. What we're going to do now is that we have a fair number of questions, which I'm going to read something out loud. And for those panelists who are able to stay, I'm going to ask you maybe to turn on your cameras at least. And I'm going to read off some of the questions and put it to the panelists, and then you can answer in turn. And what I'm doing, I'm just going to summarize the questions so we can get through as many as possible. There are some repeats, and then there are some anonymous postings that we want to respect those who are posting anonymously. So the first question is, what is it that healthcare professionals can do to help push the government for the demands that we've heard on the call today? That's one question that I'll put out there, and I guess I'll add to that, what could all workers do to amplify the demands that we've heard in the discussion today? So I'll start with maybe Jesse, if you want to start with that, and then Pam.
Yeah, great question. And so, I mean, just two examples. So again, shout out to OHIP for All, which is the amazing campaign that's been organizing for years and years and years to get rid of the arbitrary 3-month delay that people have before getting insured, and for pushing the government to cover testing. So that was an initiative that most recently got around 1,000 health providers signing a petition to government, and which worked. So a clear example of a demand that's been long time standing, and that in the midst of the crisis was pushed for and won. And I think people have also put on the link to the Decent Work and Health Network. And so an example is that, again, for years, literally years, we've been pushing to get rid of sick notes. We won that demand in 2018, then Ford government brought it back. And now, just most recently, I believe the government has removed the requirement for sick notes for workers affected by COVID. Now, of course, we need that to be for all workers and in all situations, but it just shows an example of how health workers taking the lead of workers in precarious jobs, and as part of a much broader campaign, can engage to build a movement for decent work. So look for Decent Work and Health Network and get involved, or the broader 15 Fairness movement.
Thanks, Jesse. So Pam, I'll ask if you have any comments on that question. And I'm just repeating the question for those in the chat who have asked for it to be repeated, is what is it that health professionals and health workers can do to help advance the kinds of demands that we've talked about on the call today? And what can workers do in general to help advance the demands? So Pam, I'll turn it over to you to respond to that.
So can you hear me? My video's not working. It says for some reason. Can people hear me?
Yes, we can hear you.
Okay. Thanks for that. Yes, I think it's very important that we raise our voices together for the demands that will help as many people as possible. So the 15 and Fairness petition is actually aimed not only at the federal government, but also at every provincial government. Only Quebec has taken measures to implement paid sickness benefits for all, and at the rate of $573, but it's really narrowly defined for this particular pandemic. We need, but it's an in that we can basically amplify. But I feel like it's very, very urgent that we get that message out, because the federal government right now is deciding what are these emergency programs going to look like. And now is the time for us to raise our voices loudly and clearly So sign and share the petition to help us extend the reach of 15 and fairness as much as possible. And also to phone if you have time, because you're not traveling so much or for whatever reason, call your local provincial rep and call your local federal rep. The provinces are trying to get off the hook. They're trying to say, oh, we don't need to provide paid sick days because we've got all this EI stuff happening. So if you can, at the minimum, sign and share the petition, but then go further, call your local provincial representative and call your federal member of parliament. And lastly, I really do want to emphasize the migrant rights petition and updates. Follow those, figure out what are the urgent actions that people are taking, because the modest changes that we've been getting is because people are mobilizing and organizing. But so try to amplify and share that as well if you can. And talk to your friends and neighbors and help them learn that, you know, EI is not adequate as it stands, and that we need much more dramatic measures to make sure that workers can either work in a healthy and safe environment, or they can stay home with enough income supports to let them to decide on either of those courses of action.
Thanks, Pam. So I'm going to turn to some other questions. These are health-related questions. So one, an anonymous post says, Jesse, what is your advice for someone who is sick and with chronic illness who was told by Healthline to wait in self-isolation and not go in for testing? What should someone do in a situation like that? I've also had some questions about what is the capacity of the healthcare system in Ontario and other provinces, and what will that mean if there is a spike in the number of people who are getting sick? So why don't we deal with those two questions, and then we'll get back to some others. So Jesse, please go ahead.
Yeah, thank you for that. And it's been yeah, really awful to hear the stories of so many people in a similar situation where there just is not the capacity, thanks to generations of cuts, to be able to follow up with people. Obviously, I can't give medical advice, though I'm happy to connect with people offline. I mean, also, I think it's a challenge because it's such a rapidly changing situation, and even in terms of the guidelines we're given as to who gets screened. It's literally every week is different. Plus, there's different capacity in terms of testing centers. So, I mean, I can't speak to anybody's individual case, but obviously those with chronic health issues are at higher risk and should have a lower threshold for trying to access healthcare. Though obviously that you're speaking to the very challenge of that. Yeah, I'm not sure what else I can say about that particular situation, other than it really speaks volumes about the situation we're in. And I think the more that, you know, that people feel confident, as this person did, to share their stories, it can really highlight all the gaps that are missing and that urgently need to be filled. In terms of capacity, I mean, it really is all hands on deck. You know, I mean, again, we should never have been in this situation to begin with, where we have to even contemplate, you know, rationing. You know, in one of the, you know, wealthiest countries on the planet, but we're in that situation. And in the current situation, I mean, it is very inspiring to see all the health workers really work together to try to reorganize, to try and plan, to try and redeploy. So with the current resources, I think it's really inspiring what all the colleagues are doing. And obviously we see the specter of what happened in Italy, where they're, again, literally having to decide who gets a respirator and who doesn't, which is a decision that should never have to be made, but that, again, sadly, on a global scale happens almost every day somewhere. And so I think it's, you know, we both have to do what we can do with our current supplies, but also put as many demands as possible on governments to open up more beds, to hire more and more health providers. I think there was a comment of all the health providers who are trained but who cannot provide care because their credentials from other countries are not recognized, which again is a real crime that we would actually have a shortage, not actually because of a physical shortage of human beings, but because of a shortage of who gets recognized. And I think I'll just stop there for now.
Okay, thanks. Jesse. The next question I'm going to ask is, what has the NDP been saying about these kinds of demands and the broader labor movement in response to what the federal government has announced so far? So there have been a number of questions, but what has the response been by the NDP and the broader labor movement, labor leadership in response to what's been announced by the federal government? So Pam, I'm going to ask you to respond to that one first.
Thanks for that. To be honest, I've been also quite disappointed. I had a flicker of hope that the NDP government in British Columbia would lead the way in providing paid emergency leave days for all workers, and I was shocked to my eye, and others on the chat can correct me, but certainly to my eye, it seemed that the BC government was more or less echoing what Jason Kenney, the Conservative Premier, was saying in Alberta, and what Doug Ford was saying in Ontario. And in both of those instances, at first Jason Kenney said, yes, we're going to make sure everyone has paid emergency leave, but his vision was to shunt it all over to the question of employment insurance and not to mandate it that employers provided provincially. And Doug Ford has more or less said the same thing. So on a provincial basis, it's been shocking. As I say, even when I think I can't be shocked anymore, I'm shocked. And federally, it doesn't seem to me to be a response. There doesn't seem to be a real effort federally to be pushing Trudeau on the kinds of protections that would be required. And on the issue of border closings, I mean, I was really also shocked when it seemed that the response of the NDP federally and provincially was to say that it was letting in too many Americans, like the point that Jesse made earlier. So so my own feeling is it's been, disappointing, but I also don't think that has to be a permanent situation. And I know there's in Ontario and maybe in other places this is the same thing. There's very progressive elected NDP representatives provincially who are trying to echo our demands and are trying to put that forward. So it may be the case that we don't get the response from the top that we want, but if we create enough pressure, especially where our NDP, where we have NDP members of parliament or provincial parliament, we can really be turning up the heat, and that means phoning our office and demanding much more meaningful action.
Okay, Jesse, do you want to comment on any of those questions regarding the response of the NDP and the trade union leadership?
No, I'm good.
Okay, the next set of questions, there have been a number like this. And so participants want to know, how do we respond to what looks like the coming attack on unions and on collective agreements? And some have cited the decision by the government in Quebec to suspend collective agreements for teachers. And there are worries that this is going to spread to other provinces, that the governments are going to use whatever emergency measures they have to bypass bargaining or to suspend collective agreements and to impose conditions on workers that will limit the way they can resist those or oppose those. There have also been a few questions about threats to civil liberties in general beyond collective bargaining, that what's happening with governments who are looking for extraordinary power measures to detain people, to arrest them, to fine them. I think somebody mentioned Department of Justice in the United States memo that has been submitted to Congress asking for emergency measures or suspending certain laws. So do the panelists have anything to say about those questions, the attack on collective bargaining or on unions, as well as on the broader attack on civil liberties. Pam, do you want to start with that?
To have all the answers by any stretch, and I'm sure there's folks on the line here, but I do think, again, I was shocked at how many progressive people who see themselves as socialists, were echoing the call for basically enforced quarantine. And that, of course, those kinds of strategies, or closing the borders, those kinds of strategies that strengthen the rhetoric of the state and confuse people about whether the state is operating in our interest or not. I think I've been really shocked about people on the left who see themselves as anti-capitalist to be echoing some of those statements. So I think that the comments around civil liberties and suspension of union rights are very important ones. I think it's not an accident that one of the first things that Doug Ford announced when he was making measures is to ban public gatherings of 50 more people. Like, he did that before he did, job protection for workers. So I think that is also about trying to curtail our ability to act collectively. And so I think that is an issue. I do think we're going to have to be thinking through what are the kind of demands that we need to make, sort of, short term, longer term, et cetera, et cetera. And I feel like at the moment, so many people are in desperate or, need of some basic supports, like what are they going to do for rent? What are they going to do for income? So I do feel like in some ways the more financial and economic support we can give to people, the more capacity they will have to be able to resist some of these other things that are coming down the pipeline. And but I also think that workers have a lot of power right now. And it does seem to me that with grocery store workers, for example, there's been enough of a push to get a $2 wage increase. I feel like there's things that we can be doing to, again, to use that to say, that's great, make it permanent. How do we make sure that all those grocery workers have paid sick days? And I feel like, again, that goes back to the kind of collective solutions that then will allow more agency, that will allow us to take on the particular fights that come along. And I'll also say that I think unions have had a terrible habit of trying to make demands on behalf of their own members without actually linking those demands to the broader interests of working class people, and especially those who don't have official unions to represent them. So I think unions need to do a much better job of amplifying the demands that we need for the whole working class, and using their collective ability to enforce them to be deploying that political and practical strength. And I've seen, I think there is a mentality among some unions to say, well, we didn't get paid sick days in our collective agreement, so we don't necessarily want the government to give paid sick days, because then why would anyone join a union if they're going to get it from government? And so we have to really challenge that kind of logic. So, and I think the more that unions show themselves as class fighters, the more that the class will respond with solidarity to defend their rights. So I do think that those are the kinds of considerations we have to keep in mind when we're thinking about how do we address the particulars that are coming out. But I really do feel like rent forgiveness, income support, all of those things to address the urgent and crises that are facing people right now is going to give us a bit more breathing room to take on some of those other fights. But again, I don't have all the answers. That's why we're doing calls like this. People are going to help figure this out as well.
Thanks, Pam, for that. So the next set of questions I have are for Jesse in particular. So Jesse, one question is, what is the role of expanding testing in limiting or attempting to contain the spread of the virus? And another question for Jesse is, could you talk a bit more about some approaches that governments and even some on the left are advocating, which is enforcing physical distancing by legislation or by repressive means, by threatening jail or actually detaining people or restricting their movement, and including closing the border. So could you talk a little bit more about what the limits are of those repressive approaches to encouraging physical distancing and best practices. So Jesse, I'll pass that over to you.
Great question. Yeah, and again, all these things are evolving so quickly, it's tough to keep up. I mean, I think that, again, looking at, I mean, we're in a fortunate situation in that the pandemic has not yet hit Canada, even though it will. So we can actually have the benefit, if we don't have a xenophobic approach, of actually trying to learn from as many countries as possible. And so, again, getting back to the situation in South Korea, they've had probably the most testing in the world. So Ontario, we've had 15,000 people tested. South Korea tests 15,000 people every single day. So they have a huge capacity to know, who may or may not have the virus. And this in turn is then used to educate people on exactly where cases have been, to help people, kind of empower people to know, should they be self-isolating or not, as well as the financial means to self-isolate. So I think that providing testing, obviously on a voluntary basis, is really important. One of the things I've just realized, and the challenges I've realized at work, is that for those who do not qualify for testing because they are healthy, because they don't have a risk of transmitting to others, because they're not sick and they have a mild case, the current advice for them is simply to self-isolate for 7 days because they may have COVID, which of course is a fine, advice to make. But for workers who can't take a week off, it would really help them to know if they have COVID or not, because that would really determine whether or not they actually can really try and isolate or not. So I think it really shows that again, when we're put in the situation of rationing, we can do what we can, but we have to recognize that the real limits, and to really fight against rationing by trying our best to expand testing. I also find it often ironic that situations that might lack testing then turn to mandatory testing or mandatory quarantines. And I think that we can learn from, first of all, from frontline communities. And just related to, there was another question around Indigenous communities. And when I talked about economic inequality, disproportionately affecting racialized communities, this is first and foremost Indigenous communities. And again, it's awfully ironic that there's been states of emergency declared for literally decades over a housing crisis or a water shortage crisis, which directly affect people's ability to try and contain COVID. And there's no enforcement or there's no accountability for trying to respond to those states of emergency. But now when it comes to COVID, we all of a sudden, at the blink of an eye, have police forces around the world who are being empowered to arrest people, to forcibly quarantine them. When they may actually not have, by definition, a quarantine is those who have no symptoms. So there's a good chance those people may or may not have symptoms. And so, as well as learning from frontline communities, I think we have to learn from history. Again, this is not the first pandemic that we've faced. And looking back at the movement against the AIDS crisis, all of these repressive measures were first off the bat. So there was demands to quarantine the day village. There was demands to mandatory tests. There was demands to incarcerate sex workers. There was detention of HIV positive migrants. There was travel bans on HIV positive migrants. None of those helped in any way whatsoever. I'd argue that actually made it far worse. And when we talk about testing, if somebody knows that if they test positive, they're going to be incarcerated, that's going to drive people underground. That's going to dissuade testing. So everything has to be voluntary, including isolation, or will only make things worse. And often it's presented as a balance between, we have to balance between civil rights and we have to balance between health. But in every situation that you repress civil rights, you actually undermine and exacerbate the healthcare crisis. And it's only, as these movements have shown, by asserting rights that people can then raise their horizons of what a true healthcare response can be. And again, learning from around the world, whether it's mass testing, whether it's in Spain, where they've nationalized privatized hospitals. I mean, there's all sorts of solutions, and none of them come from top-down repression. They all come from democratic aspirations from below.
Thanks, Jesse. Okay, so the next set of questions are, these have been directed to Pam. So Pam, could you talk about the workers' ability to refuse unsafe work? What are their options for refusing unsafe work? There are also questions about what can unionized workers do to organize with and support the demands of non-unionized workers. So how do workers who are organized and those who are not formally organized work together to collaborate on these demands? There is also a broader question about how do we continue to organize in the current context? How do we organize politically if we can't gather in large numbers, if we can't hold demonstrations, or if we can't be on picket lines, if we're trying to practice physical distancing? What is the capacity to organize now, and how does what we do now affect what we will do when these measures are lifted? So those are for Pam, and I still have more questions to let you know, but I'll give Pam a chance to answer some of those. So please go ahead, Pam.
Yes, really great questions. The capacity issue that Jesse's flagged around the healthcare system also exists right through the system. The capacity question for employment insurance and the capacity question with the Ministry of Labor. And I'm sure this is the same across Canada. But the way the right to refuse unsafe work is supposed to unfold is that if a worker believes they're being asked to work in unsafe conditions, and by the way, these conditions are defined by the labor code, they're supposed to call the Ministry of Labor. And then what's supposed to happen is the Ministry of Labor is supposed to send someone out there, do an inspection of the site, and then make a determination on whether or not the concern is valid, and whether or not the worker has to go back to work. But of course, you can only imagine what's happening now. The Ministry of Labor is completely inundated, so you can't get through on the phone. So workers don't necessarily know how to handle the situation. And so, for workers who really are in unsafe circumstances, that we're basically trying to advise them to get as much evidence as possible, so that if there's any kind of a reprisal, they can fight it and duke it out later. But the other thing is that some workers, and that would probably, and others on the chat can correct me if I'm wrong, but there's also some workers whose job has some risk to it. And so there's also limitations on how many workers can actually exercise their rights, and how that's defined and so forth. So just to say it's not exactly the catch-all, and keep in mind that that employers can fire workers without any rationale. Like, we don't even have, just cause protection for workers. I don't think that exists anywhere in Canada. So this makes it, possible for employers to fire workers for other reasons, even if it was triggered by. And one other thing you should know is that we have received information at the Workers' Action Center that employers are being told to, when they're filling out separation slips, records of employment, that if a worker refuses to come to work, then they should be noted as quit. And when you're noted as quit on your record of employment, you don't get access to EI. So these are just all the real life challenges that are happening because the system doesn't have enough capacity. And there's another capacity crisis looming as well, because workers who find themselves without being able to get access to EI and having to wait till April to get any emergency support that may or may not be available to them, there's going to be huge influx of demand on social assistance and welfare as workers try to make demands. And everyone knows about the really punitive restrictions on how much assets people can have. So so this every economic disaster is being compounded by the lack of supports for people on that front. In terms of how do we organize in our workplaces, I do feel like at the moment workers who are on the front lines have a lot of public support, have a lot of power, if you will. And I think raising these concerns, amplifying the questions around, what are the particularities that people are facing. The question of paid sick days, I have to say for my own self, I grew up in public sector unions. I had no idea how few private sector workers have paid sick days for their members. So one of the things, again, it's not like, unionized workers have all these special rights and benefits, and then we have to act on behalf of those poor, pathetic workers that don't have unions. It's our interests are completely collective. And the way we've been trying to explain this in the fight for 15 and fairness is by saying we need the whole entire working class to raise the floor, of wages and working conditions, and then unions can set the bar. But if unions don't step up to the plate to demand those basic floors, to demand the basic 7 paid emergency leave days plus the 14 in a pandemic, to be echoing the demands of $573 weekly income supports for all emergency programs, and apply that to social assistance or DSP for those that are not getting that kind of support. So I feel like the way unions can best protect themselves is by adding and amplifying the voices of the demands of the class. And then when the government goes to attack the unions, people will feel like, they're all in it together as well. And we've seen this happen over and over and over when unions basically step up and take up part of the fight. Even if they win in a short term for their own members, many non-union workers see that win as a down payment on the broader win for everyone else. So it feels to me like we have to really get over the sectionalism of the labor movement, throw our lot in with the community demands that people need, and through that process, we're going to protect each other so that when we support the workers without unions, then we will be in a position to ask those without unions to support us and to demand greater access to unionization for everyone. And I do think now is the time to be raising those demands and publicizing that and letting the public know what's going on inside the system, because I think this is where people are paying attention and are starting to really get the picture about how threadbare everything in our system really, really is.
Okay, thanks for that, Pam. And just to let the participants know, I believe that Rechev is still on the call. I'm not sure if Rechev is available to answer any of the questions that have been posed. So Rechev, if you can hear this now, you're welcome to respond to any of the questions that have been asked so far, but no pressure to respond if you're not able to comment at this moment. We're glad that you're still on the call, but just let me know if you'd like to jump in to respond to any of the questions that have been posed so far. Some of the other questions that have come up are, there have been a few about the turn in recent days to blame China for the crisis and the increased racism that has appeared in the media, and from governments blaming China, targeting China, talking about trying to hold the country for account. So if anyone could comment on if Jesse or Rechev or Pam could talk about what strategies have they encountered to push back on that racism and xenophobia. There's also been a few questions about the corporate nature of the bailouts that are on the table. And so what else can we do to amplify the demands of workers and to pressure governments to take up the demands of workers so that these are not corporate bailouts? I have another question, or a few questions along these lines. What is the state of organizing, of pan-Canadian organizing around these demands for the Decent Health and Work Network, or the Decent Work and Health Network, and the Fight for 15 and Fairness? Is there any sense of how those campaigns, along with the Migrant Rights Network, what kind of gains they have made since the crisis erupted? What progress have they made, and what else can organizers do or activists can do? And let me just ask one other question. I've had a couple of questions about what are the best, if repression is not, if it doesn't work, what is the best practice to encourage people to take the appropriate health measures if up until now they were resisting taking those measures? So maybe I'll start with Jesse on that last question, and Jesse, feel free to answer any of the other questions that I've posed. So Jesse, please.
Yeah, I mean, part of the reason why people might not be engaging in healthy distancing is, again, because of the position we're in currently with the pandemic, where people see the headlines that Italy is rationing ventilators, and then you go outside and things seem like they were a few weeks ago. So I think people, there's a bit of a dissonance between the warnings people are hearing and their own experiences. If the pandemic goes as planned, that will rapidly change. And so I think when people's experiences, align with the true nature of this, then I think that will rapidly bring people into line. Sadly, but again, I think that any notions of repression are only going to be counterproductive to that, and that's why it's so urgent that before the crisis hits, because it is no way hit in the scale that we're anticipating it's going to hit, that before it hits, we shore up as many policies as possible for people to empower themselves to self-isolate and for themselves to remain financially stable at home and to have a home. That's very important. In terms of the blame, again, I think I can't think of something more cruel than blaming the country whose health providers literally gave their lives to identifying the pandemic, to warning about it, to cataloging it, to writing about it, so that we now know before it's really hit, exactly what the virus is, how it affects, who it affects. I mean, all this information we're getting from Chinese health providers. How can we possibly blame them? I can't say too much more on that. And in terms of a note of hope, I mean, the Decent Work and Health Network has been around for maybe 5 or 6 years and has had the same demands for that whole time. And all of a sudden now there's a mass audience. I mean, when the editorial board of the New York Times and the Toronto Star is calling for paid sick days, when the US Senate, despite all its limitations, passed at least a limited bill on paid sick days, there's now a wide audience for making these demands. And for not only recognizing health providers, because it's obviously touching to see the different countries that have had their people gathering to applaud for nurses and hospital workers, but to identify the full variety of frontline workers. And I'm really honored to share this panel with a grocery store worker like Rechev, who is a true leader on the front lines of this pandemic, and to see that there's a greater awareness and awakening of all the work that all the workers of the world do.
Thanks for that, Jesse. Okay, Pam, would you like to respond to some of those questions?
Yes, thanks. And ditto what Jesse was saying. I do feel like there is a sudden audience because we've been laying the foundations of talking about workers in these kind of precarious situations. I think that is why we've made the gains that we have. Like, if people recall, the first announcement that Trudeau actually made around improving access to EI was merely waiving the 1-week waiting period. And I think we were all completely gobsmacked. But then the fact that he was forced to make this announcement about a sickness benefit and a support benefit that's going to be for workers who don't qualify, and specifically identifying, gig workers and misclassified workers and so forth. So in that sense, I do feel like the measures that are being debated right now are definitely a product of the organizing we've been doing. And around the border closings, the partial wins that we've been able to get is absolutely thanks to the Migrant Rights Network organizing as well. But I also want to connect two things, and that is just over a year ago, the Migrant Rights Network really came together to flagging the dynamic of the federal election, where it's very possible that politicians and the 1% are going to be using racism to drive through an austerity agenda, and that we really need to be ready and armed with the arguments, and actually train ourselves to have some of these conversations. And what we learned in this process by doing this work is that most people who adopt racist and xenophobic ideas are often because they have a false conception that there's scarcity in our world. And if we can address, they're scared for themselves, they think that things are scarce, and the dominant ideology pushes us in a particular direction. And if we take the time to kind of have those arguments, it really started to make a difference. And even the public opinion polls in the election showed that concern about borders went from, I'm forgetting the exact data, but it was something like, you know, a concern shared by 20% of the population to a concern shared by only like 3% of the population, or something like that. Don't quote me. I'll find the correct information later and share it. But it was just a dramatic drop, and that's because of the interventions. And I think the way we handle the racism and xenophobia now is because people are shit scared, and we live in a racist society. So a moral argument, I don't personally think is going to cut it, because people, you know, are scared and terrified, and they go to their go-to spaces. But my feeling is that the more that we can say that these measures don't protect us, the more that we will get a hearing. Every dollar that is spent on border control is a dollar that is not going into income support for workers or for the medical resources we need to fight the virus. We can say every time we chase people and symptoms, we're actually missing we're missing chances to self-isolate and exercise the precautions that we need to take. And we have to get the message out there that in South Korea, the biggest purveyors of the virus were not the elderly, and so far the biggest spreaders of the virus were healthy people under 30 who showed no symptoms whatsoever. And so when we chase only symptoms, we do ourselves a disservice. And again, we drain resources away from what is actually necessary on this front. And I think the more that we can do that, the better off we'll be. And I think people are open to these arguments. Viruses don't recognize imaginary lines. That's what we have to say. So if anyone is sick anywhere, it's in our collective interest to make sure they get the health care that they need. If anyone has the virus and isn't showing symptoms, they need to be able to self-isolate. They need to be able to connect with their families so that their families can be supportive of them. Like, these are such basic and logical things that I feel like, as long as we explain to people that these measures are not only racist and wretched and xenophobic, but they're actually going to kill us all because they're the wrong strategy, and they divert attention and they divert resources away from the real culprit. I feel like we can win on this too. And I think more, and even the last thing I'll just say, it was a beautiful moment when the farm workers had to basically freak out about stopping migrant workers from coming into Canada because their permanent temporary foreign worker program, that's called temporary, but it's fucking permanent, pardon my language, that suddenly these farmers are saying, we can't do without our skilled workers that have been coming back to work on our farms for every year for 20 years. We can't possibly do without them. We can't train people up that fast to do this incredibly skilled work. I think there is a new audience for people to start seeing, and for farmers to basically say, you cut off the borders from migrant workers. We're not going to have just a health crisis and an economic crisis, but we're going to have a food crisis because we are not going to get our fields planted. So to my mind, these are all incredible opportunities for us to take advantage of. But I also think we do need a socialist perspective to see these things and take advantage of them. And, and I do think that we should be part, I would invite everyone on the call to join the Spring Socialist Network, because I feel like, how do we, we have to collectively think these things through. No one person has all the right, has the right answers. Together we can come up with solutions. Together we can make hay. And if we know what things to hit on at the right time, I feel like we can really come out of this stronger. Every temporary measure that we get now, we can fight to make permanent. And every a crummy, awful temporary measure, like disregarding collective agreements, we can show how wrong and how ill-advised those things are. So even though it's a terrible thing and people are really suffering, I think if we play our cards right, we can come out of this stronger and with a much bigger opening for socialist ideas that might actually save capitalism from itself.
Okay, thank you, Pam. I've still got some questions I'm going to read out that a number of you have asked. And first, I'll just let you know, a number of people have asked if Rechev is still on the call. I think Rechev is still on the call and listening, but no longer on break, which is why he can't jump in at the moment. But I've messaged him so that at any moment, if he can jump in and wants to respond, we welcome his responses to any questions that he would like to respond to. So some other questions I have are, this one is a health-related one. What is the potential for the healthcare system in Ontario and other provinces to rapidly increase its capacity for hospital beds, for intensive care units? What would it take to expand the capacity rapidly? And also, what is the potential for retooling factories or workplaces to begin producing ventilators or respirators or masks or personal protective equipment, those sorts of things? I have another question. How is the crisis radicalizing people? So there are two parts of that. How is the crisis radicalizing people against the capitalist system in general? And how is the crisis and the response radicalizing people about what's possible? And a number of you have mentioned how all of a sudden transit is free in a number of cities, and other measures that were once thought impossible are now suddenly possible. So how are those measures radicalizing people for the long term? One other related question is, how do we prepare now for advancing socialist demands after the COVID crisis? How does what we do now affect what we plan to do in the future? Let me just quickly look and see if there are any other questions that are related to those. Oh, and one other question about the sick days is, how will 7 and then 14 days be enough to support people who need more time if they're off for a much longer period of time, or if this crisis continues for months, and or if the measures that are being put in place for physical distancing, if those become more oppressive and people can't actually go to work? So I'm going to start with Jesse, and then we'll bring it back to Pam.
Yeah, in terms of capacity, I mean, I don't know all the nitty-gritty numbers on, buildings, beds, whatnot. But I mean, what I have seen is that not only here, but from around the world, that capacity is a political question. It's not just a resource question. And I'm just thinking of all the little demands that have been made for years that all of a sudden have become, that we were told previously was impossible. So like the 3-month waiting period for OHIP, that's been a campaign for years and years and years. And I was told, no, we have to maintain it. No, we have to maintain it. Now it's been closed, like all of a sudden. Similarly with paid sick days, there's similar to other countries that have been, opening up hospitals or, using hotels that are not being used either for shelter spaces or for new hospitals. So I think, again, we're in a period where all of a sudden the questions that previously were just solved by an assumption of what was available are all of a sudden being solved through a much more rational way, which is what do we actually have access to collectively as society, and how can we use that to respond to people's needs. At the same time, I think that going forward, like with any other moment, that we need to have campaigns that we can win in the short term and that can connect us to long term. So obviously, we need way more, probably access to paid sick days, but 7 is a demand that we've had for a while. That even that has been a slog. If we can remember, we won 2 of the initial 7 demand, and then Ford reduced that to 0. So again, getting to 7 with a 14 additional for emergency leave is something which would make a significant difference, which is completely possible at any time in which there is now a political opening. And if we can win that demand in the short term, then I think that can give us a lot of confidence to be raising greater demands around this and a lot of other issues. So I think part of it is just figuring out how we can win in the short term, and through the process open the train for much wider and broader and more accessible gains in the future.
Okay, thanks, Jesse. Pam, do you want to respond to some of those questions?
Yes. And so one of the reasons why the Fight for 15 and Fairness demands are not merely paid sick days, and also the same for the health providers as well, not merely just the paid sick days, but also a dramatic expansion in access to employment insurance is exactly that. It's that, so we need a kind of combination of things. So we, you know, it's astonishing to me that so many workers don't have paid sick days. So if we could come out of this with a guarantee that every worker would get 7 fully paid emergency leave days, plus an additional 14 during pandemics, and if there's going to be another outbreak, because we may get through this one and then there's a relapse in the fall, we don't know how it's going to unfold. But that's certainly something that I think would be an economic stabilizer, so that workers wouldn't be just completely out of income, that they wouldn't just lose income right off the bat in these particular moments. But in addition to that, EI needs a massive overhaul. Like, it really needs to be much longer. It should be, you know, up to a year of benefits. Like right now, people only get a few weeks of benefits, depending on what the economic situation is in 15 different economic zones across Canada. Like the EI is so complicated right now because it's all designed to try to incentivize getting workers back into the workplace and so forth, that a lot of workers can't get it. But what if EI replaced 75% of income? Or why not 100%? I mean, you know, obviously we have to have credible demands, or workers aren't going to, you know, put time and energy into fighting for them. So we should find out what workers want to fight for. But definitely everyone is recognizing that 55% doesn't cut the mustard here. And so we need an income replacement program that is going to be adequate for people. We need more people to be able to get it, and we need to make sure that employers fund it. One other thing I'll just say about the EI program is that there was a time when the EI system was funded by 3 players. It was funded by workers, it was funded by employers, and it was funded by the federal government. But again, the federal government got out of the funding EI business decades ago as part of their austerity agenda. So we could be, you know, you could imagine a fund that was actually big enough that could replace people's income for a long enough period of time that would support them through these things. And that goes with the sickness benefit, and that also goes with the parental leaves as well, because what the EI evidence shows us is that the income replacement is so marginal that most people in low income jobs never avail themselves of parental leave, precisely because you couldn't possibly live on it. So basically, parental leave becomes something that, you know, well-to-do workers are able to access, and some places even have an EI top-up program for that. But for most workers in precarious employment, EI parental benefits is not even an option because it doesn't provide enough for a worker to live. So these are the things that we have to be demanding and talking about as we fight for paid sick days, as we fight for the emergency fund to leave no worker behind, as we fight for rent freezes and free transit and open borders and all of those things. Those are the practical things I think that are going to help us. And hopefully come out stronger, because if we can win these things on a permanent basis, the more agency people have, the more flexibility people have, the more security people have, the more they're going to be able to engage in the political process and feel confident. If we win a few things coming out of this, that confidence that it's possible is not going to go away overnight. So I also do think it's like, what are the things that we think we could win on? And honest to God, if we can't get paid sick days out of a global pandemic, then I don't know what we can get. So these are the kinds of things I really do feel like we have to prioritize so that we can get some of these things, and then promise to never go back, never going back once we get them.
Okay, thanks for that, Pam. I just heard from Rechev, who has been listening and is able to respond to some questions. So just before you come on, Rechev, I was going to read aloud some of the questions that have been posed for you. So there have been quite a few questions about what are the particular demands that food service or grocery workers or frontline workers have been raising. What can we do to support you and those demands? What is the response of your union leadership to the kinds of demands that workers are putting forward as they organize in these new conditions? So Rechev, I'm going to unmute you, and feel free to respond to those questions and any other questions or comments you'd like to make. So please go ahead, Rechev.
Well, I think for us, like some of the biggest issues is having like paid time off, and not necessarily like for ourselves because like we're sick, but a lot of our cashiers here have kids who are home right now, and they literally have to get babysitters, right? So that's money out of their pockets. Um, Another major concern, just to go back on a question that was raised probably like 10 minutes ago in terms of like the racism, before all this was like deemed a global pandemic. I was working one day and I get a call from one of the cashiers at the front, and then I go to the front, and then there's a lady there standing and looking at the cashier, right? And I'm like, hello, what's up? And she's like, the cashier just started crying. She's like, this lady just asked me why I'm not wearing gloves and a mask. And it's basically because she was Filipino. And I'm looking at the other lady and I'm like, miss, you can't say that. That's like racist. I'm gonna need you to go out of this. Like, I'm gonna need you to leave the store right now. And she's like, no, I'm right. These people are coming here and they're bringing their disease. And I'm like, miss, if you don't leave, based on what you said, no, I'm gonna call the police. Right? So that's the extent that we had to take it to. And this was before all of this got like super, super crazy. This was like in the beginning, I think in January, right? Other issues like based on like the like where we can go in terms of like being socialist. Like for me personally, like I remember when the 59 Fairness campaign started, like Galen Weston, he was like one of the main opposers to a $15 minimum wage. Now he's paying all of his Loblos, all of his no-frills staff $16 an hour, right? So it just makes me think like, okay, you're against 15, but now because you're a crisis, we're in a crisis, and your stores are deemed as the essential services. You're agreeing to pay 16. I have people at my work here who's at top rate because of the union. I have cashiers making $17 an hour, and just to see the pride and joy in their eyes, man, it's amazing. Like, I know everybody's still looking out for their safety, but at least they come to work now with a little bit more pride, a little bit more joy in their step, right? And the sad thing about it, it has me thinking, what am I gonna do? What is Rechev gonna do with his allies to keep that joy in their eye? Because on April 30th, when they revisit this, if they come and they're like, oh yeah, you guys are going back to like normal minimum wage, it's gonna hurt, right? And it's gonna make them think about themselves and their worth. And if what really did for like a month and a half was just like, oh, did the company just use us because they had to stay open, right? Like, so for me, the next couple of weeks is just to empower them, right? And if we can get help through social media by people just promoting us as essential services like nurses and doctors, that's what people can do to help us in our fight here. Because believe me, we're gonna really fight hard to try and keep the $2 increase that we have, because it's going to be unfair to a lot of us, to a lot of our part-timers who come to work with such pride and joy every day, you know, put their safety at risk. Not only like their safety in terms of being at the store, but a lot of us here, we don't have cars, we take public transit, right? Like, so yeah, that's my input on this.
Thanks for that, Rechev. So we're getting close to the end of this webinar, and what I'm going to do, I'm just going to make a few announcements, and then I'm going to hand it back to all the panelists, just maybe to take a couple of minutes or more to offer some concluding remarks. So first, I want to thank everybody who has been on this call for all your questions and comments. Thanks to those who have been providing links and resources. We're going to share all of this afterwards, including a recording of this webinar, a list of the links, the slides. So all the things that we want to share, we want to make sure that you have access to those. I'm going to ask the speakers when they come back, I'll just say this now, when you come back, if you could maybe talk about the concrete next steps we could be taking in the next few days and weeks. What do we need to do now to advance these demands and support one another? That has been a common question among the participants, so I'd encourage the speakers to think a little bit about that. Some other next steps that you might want to think about is Spring Magazine wants to do more of these events over the coming days and weeks. So if you'd like to be notified about those, I'd encourage you to go to springmag.ca. And if you scroll down to the bottom of the page, you can just drop in your email and subscribe to our email list, and you'll be notified of all the things that we're doing. We've got a few more of these webinars and online interactive forums that are coming up. So I'll just briefly mention those to you now. We've got on Wednesday, members of Spring in Vancouver will be hosting a book club on Indigenous sovereignty and socialism. Spring members in Toronto will be hosting a Toronto book club on Friday on the topic of Indigenous sovereignty, eco-socialism, and social change. Those two will be as Zoom meetings where you will be able to see everybody who's participating and everybody will be able to speak. So it'll be a bit more interactive than a webinar. So those are on Wednesday and Friday this week. There's also going to be another webinar on March 29th, next Sunday, and that one is going to be called Why You Should Be a Socialist. So we'll be taking up a lot of the same issues that we've been discussing today, and that will be a webinar next Sunday. Any other meetings we post or anything else we organize, we'll let you know on our email list. So we encourage you to get on the email list and find out what we're doing. When you go to the website, you'll also see that we are on a number of social media platforms. You can find us on Facebook, on Twitter, and on Instagram. So you can follow us there. And if you like the Spring Magazine page on Facebook, you'll be able to share there and elsewhere all the articles that we post. So we encourage you to look at those. There were two key petitions that were mentioned during this call. One that's been organized by the 15 in Fairness campaign. And I think the link for that website has been circulated, but if you don't have it, it's 15andfairness.org. And if you go to that main page, the key item there is to click on the petition, sign and share the petition for health emergency labor protections for workers. We encourage you to sign it, but also take the steps to share it and encourage others to add their voice to the demand. Same goes for the Migrant Rights Network, which is, I think the link has also been provided online. So I encourage you to go there. And there is a petition that network has immediately available as soon as you go online. The last thing I'll just say about Spring is that the easiest way for you to get involved in Spring, besides participating in these meetings, is to write for our publication. We are hoping to organize a webinar soon about writing articles, political articles, and how to build an audience, how to spread this information as widely as possible. So if you would like to use Spring Magazine as a way to promote what's happening in your community or to build solidarity to support campaigns, we would encourage you to be in touch with Spring, and so we can use our platform to reach as many people as possible and to continue organizing a network of socialists and activists right across the country who want to organize now in response to the crisis, to defend workers' rights, to protect everybody, but also for the long term, to fight for a social society. So we encourage you to be involved in all those things. I think that's it from me. Again, thank you everybody for participating, and I'm going to hand it back to, and also thank you to the panelists for their excellent presentations and for responding to all the questions. What I'm going to do now is ask them to just take a few minutes to respond to wrap up, and maybe I'll start with you, Rechev, just because you're available now, and if you have any concluding remarks, you can go now. So Rechev, I'll give it to you. I'll hand it over to you. So I'm not sure if Rechev is still able to join. So what I'll just, okay, sorry, yeah. Go ahead, Rechev.
I just want to say, like, thanks everybody for being on this call, and thanks for having me as a panelist. And I just want to remind people, like, when you go to your local grocery stores, when you go to your local food service stores, you know, just a simple thank you really goes a long way. Like, a lot of our workers here have been telling me that, you know, a lot of customers been coming to them and telling them thank you, you know, for coming to work, and they felt so like joyful and so fulfilling. So that goes a long way. Those are like simple things that you could do just to support us and encourage us. And yeah, like we're in a time that like we've never seen, and there's a lot of opportunity and capacity to build and push our socialist ideas and our socialist movement forward. We have companies like Lablos actually increasing from our $15 demand and going 16, right? So that just goes to show like if there's like a need for it, that they will bend and they will fall. So yeah, thank you. And I'm gonna keep organizing my workplace, and I'm gonna keep pushing my union, to push for more, including paid sick days. So thank you guys for having me.
Thanks, Rechev, for participating, and especially from work. We're really grateful that you were able to join us. Jesse or Pam, I'll offer you a couple of minutes each to make some concluding remarks. Jesse, do you want to go next?
So again, thanks everyone for joining, for asking questions, for provoking comments, and again, this is just something that we've just started. I'm still getting used to the kind of transition online, which of course can't all be online, but this is just really wonderful. On the one hand, it feels like the worst of times. We've got a global pandemic, there's backlash, there's healthcare cuts, there's inequality, and there is the real potential for this to get much, much worse, both in terms of the scale of the crisis, in terms of who's affected, in terms of racism, border control, and attacks on civil liberties. But it also, at the same time, does feel like the best of times. We have all these movements on which any gains that we're making now are possible, from Indigenous rights to migrant justice, from decent work to healthcare. And what keeps me going every day is just all the demands that have been made for so long that we're told were impossible, and that suddenly are possible, or that we have the glimpse of it being possible, from ending deportations and ending evictions, to freezing rent and providing free transit, to expanding free healthcare and who has access to it. But none of these losses and none of these gains are automatic. And I think that whatever we do, all of us together, really matters. And the more we can find ways like this and many other ways to learn from each other, to organize together, despite the healthy distancing, the more gains we can make in the immediate here and now, which again, any gain we make now will truly affect the outcome of the pandemic, not only in terms of the medical impacts, but all the social, economic, and political impacts. And just I look forward to joining with everyone else in the process.
Thanks, Jesse. And Pam, if you have any concluding remarks, please go ahead now.
Yes, just to thank all the participants on this call. I certainly feel stronger and more, Thanks so much to everyone on the call, because I certainly feel stronger and more hopeful and more confident. I think that's the thing, the challenge for us is to always be thinking about, what's the key link on the way forward, but also what's the weak link, so that we're both leading on the places where we can get the most gains, but also identifying where are we weak, where are we divided by racism and xenophobia, where are we, where are there vulnerable workers, so we're not leaving anyone behind. And I feel like if we bring that analysis to everything we do, we have a good chance at making gains in the here and now. And I would even say, let's not wait until April 30th around the wage increases. Let's support Rechev and all of his co-workers across the country by demanding every time we go into the store, make the wage increase permanent, paid sick days now. Like, what if we were talking about that when we go into the grocery stores and the drugstores and so forth? So let's be fighting now for what we need coming out of it. And I do feel like that's going to build our confidence. And then last thing I'll just throw out, I want to thank all the organizations whose frontline grounded work that is based on workers' actual needs, the Workers' Action Center, the Migrant Rights Network, the Decent Work and Health Network, OHIP for All, Harvesting Freedom, and the free transit campaigns, all of those people who are doing the frontlines works, who are making sure that our demands, when we raise them up, land with people, resonate with people, and are taken up by people. So again, a shout out to all of those incredible organizations. And then what can we do as organized socialists to be as effective as we can possibly be, and to be laying the foundations for a much better world coming out of this. And I'll just end by saying, I really do feel, I've been an organized socialist for most of my adult life, and I have never been as convinced as I am at this moment about how desperately we need socialists who have a perspective of the international working class, of socialism from below, of radical democracy that puts people and the planet first and sends corporations into the dustbin of history. So I'll invite you all back for the next weekend's webinar, where we can talk about what it would mean to be an organized socialist. And thank you all again so much. I feel so hopeful after this call. Thank you.
Okay, everybody, thank you again for all your comments, for the helpful links, the suggestions, your excellent questions and contributions. This is just the beginning of lots of organizing we hope to do together. So please stay in touch so we can let you know about other opportunities to organize like this and elsewhere. So thanks again for participating, everybody. I'm going to close the call now. Okay, bye.